Hi everyone, my name is Jaime Langosch, and today I'll be presenting on an interdisciplinary approach to understanding and supporting puberty in individuals with autism spectrum disorder. Puberty is a challenging time for any adolescent, but for those with autism, it can be particularly difficult. So this project would focus on creating tailored educational materials and strategies to help these individuals navigate this critical developmental period. Today, I'll discuss how we merge expertise from mental health and speech and language pathology to address these unique challenges faced by those individuals. And why is this important? Adolescents with autism face several additional challenges during puberty, including social communicational difficulties, sensory sensitivities, repetitive behaviors, and executive functioning challenges. So addressing these issues requires a collaborative effort between mental health professionals and speech and language pathologists to provide this comprehensive support. An interdisciplinary approach involves the mental health professional, which would be able to provide insights into the emotional and psychological aspects of puberty, such as coping strategies, stress management, and self-esteem development, while the speech and language pathologist can address these communication challenges, facilitate social skills development, and promote effective communication strategies through speech therapy and other interventions. Together, we can develop this holistic intervention plan tailored to the needs of individuals with autism, promoting their social and emotional well-being and enhancing their communication abilities. So, a methodology for this would be to first identify the target audience and their needs. This would involve considering factors like age, sex, the autism level of diagnosis, which would be 1, 2, or 3, and the involvement of parents and schools. Then we would want to form the interdisciplinary team. We'd want to collaborate with the speech and language pathologist to choose appropriate visuals and maybe some alternative communication programs. We then would want to identify key concerns, maybe through conducting interviews and a factor analysis to determine the top concerns during the puberty transition. We would want to then develop psychoeducational materials. This can be like creating a comprehensive book, something maybe titled Understanding Autism, Navigating Puberty, and Beyond. Then, of course, we'd want that feedback and revisions to continuously refine our materials based on that. So this book that we could create would include chapters on psychoeducation, which would be the basic information about autism and puberty, personal hygiene, which could involve the step-by-step guides with visual aids for tasks like bathing and brushing teeth, growth and development, which would explain physical changes with simple illustrations, and then there's one shown below, and menstruation for females, which could provide clear information in diagrams about the menstrual cycle and the use of feminine hygiene products. And the last part can be about touching and masturbation. We can teach about personal boundaries, privacy, consent, and healthy behaviors in a developmentally appropriate way. This project addresses a significant gap in research and practice by creating a standardized yet individualized guidelines for supporting puberty in individuals with autism. So we would advocate for this interdisciplinary collaboration. We can involve occupational therapists, medical doctors, and any other specialists. We'd also want to look for longitudinal studies so we can gather the feedback and improve interventions over time. So by fostering open dialogue and using sensory-friendly resources, we aim to empower individuals with autism to navigate puberty confidently, promoting their self-awareness and social integration. In conclusion, this interdisciplinary approach seeks to enhance the overall well-being of individuals with autism during puberty. By combining the expertise of mental health professionals and speech and language pathologists, we can provide comprehensive support that addresses the multifaceted needs of these individuals. If you have any questions or need further information, please contact me. My information is written below. Thank you for your attention and for attending, and I look forward to your questions.